everyone, and welcome to Rural Roots, a road less traveled, a podcast by North Country Healthcare.
We're your hosts. I'm Gavin Cook.
And I'm Ren Anderson, and we're so glad you're here. Gavin, we have Evelyn here with us today. Evelyn is the Clinical Director of Behavioral Health and Substance Abuse Services for North Country Healthcare. Evelyn, we are so excited to have you here with us today. And we'd like to start our episodes hearing from our guests and how they kind of got on to this road less traveled that took them to North Country Healthcare. Why don't you tell us a little bit about yourself and what led you to your role at NCH?
So thanks for inviting me to chat with you a little bit today. I have been at North Country Healthcare for 10 years now. I got here basically because of my husband. He was the pastor at the Gorham Congregational Church, and I really needed a job. We had a kid just starting college. You both got to work. So I applied at that point 10 years ago. Behavioral health consisted of me and a psychiatric nurse practitioner.
Wow.
I really wasn't all that busy. People hadn't kind of found out what behavioral health was, how we could support primary care, so it's been a growing process. And we did not have substance use services at that point. We obviously had them, the obvious people dealing with addiction issues, but we didn't have anything formal. So our MAT program came into being about 6 years ago, and that has really just caused the department to grow exponentially. And the need for behavioral health services has also grown exponentially. So currently we have 3 psychiatric nurse practitioners, we have 5 therapists, and 3 case managers, and then 4 MAs, an administrative assistant, and a clinical practice manager and assistant practice manager. So we've turned into a really active and fully developed department.
Mm-hmm. And I heard you use an acronym in there, MAT. Can you just explain what that is for any of our listeners? Yeah, that's okay. That's okay.
So for people dealing with opioid addiction, we use Suboxone, which is a medication that helps block those receptors so that you don't get that high. So we have a number of people that are on Suboxone or Sublocade or things like that in that program.
Thank you.
Great. And Evelyn, what does a day-to-day what does your day look like each day?
My day looks really interesting each day. I would love to tell you I know what my day is going to look like, but I just, I don't. So I not only am I the clinical director, I'm also a therapist full-time. So today, for example, is one of my administrative days. So I have the morning without patients, but starting at 1 o'clock, I will be seeing patients all day, and that's pretty much how it goes. Sometimes there'll be crises, and then you got to pause and deal with that as quickly as you can. I see people as young as 4, and I see people well into their 80s. I don't do substance abuse treatment. That's just, I have lots of people that do that and are good at it, so that's not really my strength. I love kids. I love to see my little people because they just have so much energy and they're so curious. And you can really help them develop skills that are important. I spend a lot of time talking about executive functioning, which are all those parts of your brain that help you organize things, help you learn that there's times and places for different kinds of behavior. And things like that. I also really enjoy seeing adults because it's a whole different kind of work. than with kids. You know, with adults, I can, again, a lot of the work that we do is really helping people develop skills. Therapy is not supposed to be forever, though lots of people would like to be, because it's fun to come in and talk to somebody. But it really is about, okay, what can I do to help you have the tools so you can manage life in the way that you want to, and so that you can find pleasure and enjoyment of things.
And what are some of the biggest challenges people face in seeking care for behavioral health? Or I know you said it wasn't really your bailiwick, but or substance abuse. What do you think really? What are those barriers, and what do they look like?
The big so I'm going to kind of divide out substance abuse and behavioral health. Substance abuse, we really do, I think, a good job of helping people access care. I think the biggest barrier to treatment for folks dealing with substance abuse is that, you know, addiction is horrible. And it tells you that what you'd really like to do and what will really make your life better is if you keep using whatever this is. And it's like, you know, it's like having a monster on your shoulder that's always like whispering, you really want to do this? Come on, you really want to do this? But we have a really excellent substance abuse team. We have therapists and nurse practitioners that are really well trained, and we have case managers, and so we have more availability. Behavioral health, the biggest barrier is just is practitioners and providers. There is a nationwide shortage of licensed mental health professionals. So right now at North Country Healthcare, for example, we have a really large waiting list. And so there is a wait for services, and people get really frustrated by that. And believe me, if there's anything that keeps me up at night that is job related, it would be the length of my waiting list. Because it's one we really struggle, that's something we really struggle to fix, you know. In my ideal world, you'd call up and you'd get to see somebody next week. That's not going to happen. But we're looking at shifting some models so that there may be more ease of getting in, even for short-term kinds of things. Yeah.
And do you think, are there any opportunities for our community or our primary providers or to help, you know, support some of those mental health and behavioral health issues earlier in the process before they're needing your assistance? You know, what can our communities do as North Country Healthcare?
That's a really good question. I think in kind of the Lancaster, Whitefield, Jefferson area, we're really lucky because that school district employs a truly amazing team of school social workers and mental health professionals who are really good at providing support to kids on site. We have there's some local programs in terms of helping parents with early childhood needs, and some good programs that go into the home to help parents, just give them some support in terms of parenting. You know, children do not come with manuals, sadly. And I always say to people, you know, here's the deal: about the time you get one developmental stage figured out, they go and shift into another one. And so you're always behind the 8 ball. And so I think those supports are really good for parents. You know, my brother and sister-in-law lived in Missouri, and they are both very well educated, highly organized humans, and then they had twins, and everything just kind of went off the rails. But the state of Missouri has this great program where for the first year of your child's life, you get a visitor. You get a visit from a child development person once a month,
Wow.
whether you need it or not. If you need it, you get more visits. But whether or not you need it, you get one visit a month where you can just say, oh my God, they're going to kill each other over a toy. What do I do? And the answer is you put the toy in timeout, and then they can't argue it over anymore. But you don't necessarily, in the moment, if you're a new parent, think about that kind of stuff.
Yeah.
I would love to see that for every for just every person in the country, because I think it's so useful, and I think we could prevent so much, so many difficulties that occur later on if parents just got some of those early tools. Because parents want to be good parents. Nobody wants to be a bad parent. Everybody wants to be a really good parent. But sometimes you just need some support. I know I did. Yeah. So I think looking at those creative ways where we can help people feel supported in their journey as parents. On the other end of the spectrum, I think one of the biggest issues for older folk is just that sense of loneliness and isolation.
Mm.
So I think, for example, the Episcopal Church in Lancaster has this great program called The Gathering Place on Wednesday mornings from, I think, 10 until 1 maybe.
Mm-hmm.
Where people can just go and they can hang out and they can get a meal and they can play some cards or talk or do whatever it is, but helping to create more of those points of connections for people that maybe aren't formal. You don't need a therapist when you're lonely. You need somebody to talk to, and you need to help find community. And I guess that overall is one of the biggest issues that I think would help behavioral health is how do we improve that sense of community?
Yeah.
How do we let people know what's out there and how they can connect?
Mm-hmm.
I think in a lot of ways, even though it's been 5 years, we're still a community recovering from COVID.
Sure.
Because I think we got really used to staying home and talking to people on video. And that's great, but it's not as good as that cup of coffee with a friend, so that you can see each other. You can really talk to each other. So yeah, I guess that would be my big pitch is helping us develop community.
Well, on the topic of community, but slightly switching gears, we recently became a recovery-friendly workplace earlier in July, and with it now being National Recovery Month, I think it's a great time to bring up that topic of community. And now we are the largest workplace in the North Country that is a recovery-friendly workplace. So can you talk a little bit about the stigma that is being recovery-friendly and kind of what that looks like, what that means for not only us as North Country Healthcare, but our community as well?
I think, for me at least, being recovery friendly means that, being in recovery is a little teeny tiny piece of who you are. There's a lot else about you. And being in recovery doesn't mean you can't work. It does not mean that you are disabled for the rest of your life. It means that you have done a really, really hard thing. And we support you in continuing to do that. So, it might mean that if somebody say, that if folks say, hey, I need to go see my therapist. I need to go see my medication provider. That we work to help facilitate that. We take that's one of my biggest pushes. If we're going to be recovery friendly, then we need to make sure that they're not barriers to people continuing to seek treatment. It's really hard. There are only so many hours in the day after like 3 o'clock in the afternoon, and that's really tough. So I think I am hopeful that part of that is going to be that staff can have some more freedom to keep appointments during the day. Because I think an appointment with your therapist or your med provider or your case manager, that's just as important as an appointment with your PCP. so that those things are on the same level.
Well, Gavin, I know you're working on developing a lot of the policies around this. Are you going to be able to meet these recommendations that Evelyn's talking about?
Yeah, yeah, absolutely. And that's we're quite in the middle of the policy. And one of the last pieces is actually getting in touch with our substance team and our behavioral health team because it is so important. So Evelyn, you can certainly expect communication from myself and our HR
Awesome.
team
I love
soon. So
that. Because that, we see one of the challenges is we see a lot of employees. Um, Therapists, like, we keep really good boundaries, or we try really hard to, and it's tough to see people in your own workplace,
Yep.
because I may be walking down the hall. My standard thing is, if you speak to me, I'll say hey back. If you don't, I'm just going to ignore you. And that's fine. But sometimes it's awkward to have to see people in multiple roles, and that gets confusing. So it is really, it's tough. It's tough. It's tough in a small town because everybody knows everybody. I cannot tell you the number of times I've been in the grocery store in Shaw's and I'll hear this, flap, 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 and I know it's a kid, and they come running up behind me and they go, "What are you doing here?" Like, "I'm buying groceries." "But you're not in your office," because they think if you're 5 that I live in my office, in
Yep.
fact.
That teacher effect.
Yeah, it's that teacher effect. It's the same thing. I must live in my office. That's where they see me, so it's okay. But the same is true for adults. They may also run into me in the grocery store, or other kinds of places. Parenting and doing this kind of work in a small town is really challenging. When I lived we moved here from rural New York State. We lived in Allegheny County, which is the poorest county in the state of New York. So my husband and I are not sure what it says about us that we like to spend all of our time in the poorest counties in various states. We don't know what that's about, but it's been a thing. And at that point I was seeing mostly kids, and my first question was always, whose class are they in? Because it's really hard to have people in your kids' classes. That's really tough. So, balancing all those various roles, and especially in the workplace, it gets hard. It gets really hard. And, also coming to therapy can be emotional. So sometimes it's hard to come to therapy and then go back to doing what you're doing. That's really tough because you may have needed to think about and talk about stuff that you really, is hard to think and talk about.
Definitely.
So yeah, but Gavin, I would love to have that conversation about how we can do that.
Amazing. And beyond, supporting our staff as a recovery-friendly workplace, what role can everyday healthcare staff, regardless of their department, play in supporting behavioral health, especially knowing, one of your concerns is just the sheer amount of people who need help. What can they do? What can any North Country healthcare person do today?
I think the biggest thing that we can all do for each other is to be kind. And I think that's a universal truth. There is a lot to be said for smiling and saying hello. I think because that helps people's mental health. That helps you feel better. That helps you feel like you're in a place where you care about each other. And that I think, whether you're dealing with mental health issues or you're not, that's just really helpful. I think knowing that you can go to somebody and say, "Hey, I'm having a really hard time. Can you get me some help?" We also have KGA, which is our Employee Assistance Program, which provides all kinds of counseling, and you can access those folks. That's a really nice benefit that we provide, and I think it's important for people to remember that's there. That you can get some therapy, you can get support with figuring out finances, you can get some legal advice, all of those good things are there. Because all of those, those things, those concrete things really are underpinnings of mental health. You can't have good mental health if you don't have a place to live and feel safe there.
True. Yeah. Yeah, those social determinants of health. Gavin, we've touched on them. I can't remember who was our guest, but that our HR team, it just has so much knowledge and a really kind place to go when you're struggling either with housing, fuel assistance, and then those mental health needs. We should probably get someone from the HR department to come on and talk about those benefits.
Yeah, absolutely.
So there's your
Absolutely.
homework, Gavin.
Yeah, absolutely.
I
Well,
love to make more work for people.
I love it.
that's great. Well, Evelyn, we've reached the point where it's sort of becoming my famous question of our podcast, but I'm going to change it up today and do a little two-parter with it.
Okay.
So the first part, can you possibly share a moment of, not what makes you tick and come to work each day, but why the work matters to you personally, why you do this every single day, and then kind of tie that into what makes you wake up and come in every day. I guess it is 1A and 1B.
It is kind of one or the other, yeah. So what makes me come into work every day? Well, there's a couple of things. First of all, my team. Our behavioral health and substance abuse department is fantastic. We work really well together most of the time. We have our moments and our squabbles.
You're human.
That's human. Some days I have to announce that I am putting on my clinical director hat, and we are going to do it this way, and now you can all throw, virtual Rotten Tomatoes at me. That's our moments, and we get through them with laughter and humor. And that's big for me. Seeing a patient be successful, seeing them meet their goals, seeing them doing better, that does a lot for me. That just makes me really happy, seeing somebody get better. I have a couple kids that I saw as high schoolers that, were home this summer for college, and they're like, can I just come see you one time? And I'm, absolutely, come on in. I want to hear what you've been doing. What's up? What's going on? And that makes me incredibly happy when stuff like that happens. So that's kind of, that's what keeps me going. I've been at this kind of work for 30 years, which is a really long time, my gosh. And I've worked in a lot of settings. I had not worked in a medical-based setting before I came here. It was very confusing. The first morning I was here, our medical assistant walked into my office and said, "What can I do to help you?" And I'm like, "What do you mean, what can you do to help me?" Social workers don't, have access to medical assistance in community spaces, and he was like, "Well, I can call people back for you." "You can do it." "What? Oh, how interesting!" That's really cool. So the support services here are great. Our IT department, I cannot say enough nice things about them. Computers and I are not good together. We're not. If there's a way for me to do something to mess up a computer thing, I'm gonna find it. But IT has yet to yell at me about that, and that's really great. I'll send messages that simply say help, and someone comes downstairs and goes, "What'd you do now?" So yeah, I think our support services are really good. I'm very fond of our HR department. I think you guys do good work. Yeah. So this overall is a good place to. It's a good place to be. Are there moments when we need to change things up and do better? Absolutely.
Sure.
But I think we have to keep being that those agents of change, because that's what really keeps that we're going somewhere, that we're doing some things, that we're talking about what we're doing.
Yep. Yep, that high reliability organizational concept really comes out there. I want to, you said you had been in the field for 30 years, and I just want to ask for anyone who is thinking about going into the behavioral health field, what advice do you have? What advice do you have for little Evelyn 30 years ago that you wish that she had?
Well, I taught high school history for 3 years before I went and got my master's in social work. I always tell teenagers that I am the poster child for not knowing what you want to be when you grow up, when you start college. I went to college because I really thought what I wanted to do was teach, probably medieval history on the college level. I took I didn't want to do that. I ended up switching to a major in South Asian studies and spent 6 months in India. And then I taught for 3 years. And what happened for me was I reached the point where I had to go back to grad school. And I realized that that I didn't really care for my education classes. I didn't want to do that again. Now, mind you, I took one psych class in college, and it bored me to tears. So I don't know how well that works, but it does. So I started talking with somebody who really became a mentor to me about what I should do next. And, she told me to think about social work because social workers we're systems people. We like to see the big picture, whether the big picture is a community, a family, or even just an individual. How do you interact with all those points in the system? So that's what really got me excited about this. I think finding and having mentors is really important. And I think as a field, a lot of us are aging. We will not discuss how old I am, but I'm pretty gosh darn ancient. So I think helping to train up that next generation. I'm really proud of the fact that my daughter has a bachelor's in social work, and is looking in a couple of years to get her master's. She does in-home work or actually in-school work. She just started a new job today with nonverbal autistic preschoolers.
Wow.
Teaching them hands-on kinds of skills. So I think the biggest thing is, get as much experiences as you can. Find somebody that's going to be your mentor. Who is it you're going to go talk to? One of the big pieces of mental health as a profession is supervision. Who do you go to talk to about your cases? Who kind of gives you that bird's eye view? Everybody in our department gets once a month hour of clinical supervision with me. We do a weekly group consultation where we talk about cases, we talk about stuff. Sometimes we just talk about life. So yeah, I think the biggest piece of advice I would give to anybody that's starting out is go for it, because it's a great profession. And then to also just get good mentorships, find good people along the way. You may have to look for them, but find them.
Yep.
I'm always up for being that person. So.
Oh, an open offer from
That's
Evelyn
great.
too.
Wonderful. Well, as we wrap up here, Evelyn, I would like to just open the floor to you. If you have anything, as we say, if you'd like to plug anything, or if you would like to leave our listeners with one last message about, substance use disorder or behavioral health, I will open the floor to you.
Wow, I want you to talk about more things. That's really, yeah. So I think one of the things that is really important is taking care of yourself, and figuring out how to do that. As people, we do not do well if we're not being creative. Okay, if we're not making something, creating something, thinking about something, it doesn't have to be great, but it's really important. I think one of the biggest parts, I think, in my spare time, I'm a storyteller. I actually have a book of children's stories coming out at some point. You said I could
Oh,
tell you
wow.
names.
Yeah, absolutely.
Um,
Yeah.
and so that for me really feeds that creative part of me, and that's really important. Um, One of the best things for me about living up here in the North Country is we got the Weather Vane Theater. My kids both worked there, and that was an incredibly nurturing place for both of them at what were really tough and key times in their life. And since I ran out of children to donate to the Weather Vane, my husband and I now usher. But that, for me, being part of that kind of creative community, and being able to sit there and have someone tell me a story and even sing songs about it, that for me is self-care. I saw two shows this weekend, so I'm really happy right now. Because I got to do that. So I think finding those places where you can be creative, finding that sense of community, and finding ways to tell your story and to share your story with others. And maybe it's not just a story about you. Maybe it's a story about something that happened to you, or happened to someone. It can be a happy story. It can be a sad story. But stories are what link us all together, as a community. And I just think the power of that, is really important in being healthy.
Well, Evelyn, you're speaking my love language when it comes to storytelling. So thank you for ending us on that note. Oh, man. Well, we can't thank you enough for your time today. And we look forward to helping support you and your team as we move forward as North Country Healthcare. So thank you so much.
Yes,
Thank
thank you
you.
for
It's great
joining
to talk
us.
with you.
Of behavioral health providers and smile more. Although I smile a lot.
I know. I've ran into her once when I've been on site, and she is just such a delight. She's always smiling, always friendly, and like she said, that kindness that she said is so
Yeah.
important. She certainly represents it. She's wonderful, and I think, well, I know I'm personally looking forward to working with her now that she's put the offer out
Yeah.
regarding the recovery friendly workplace policy. It's been a bit of a process for me to try and put that together. So with her offering her services, I am certainly going to take her up on it.
Yeah. Yeah, Evelyn's great. Her whole team is just really passionate about what they do. I end up working with Lisa Rompre a lot through our programs, and they're just passionate. They're passionate about substance use disorder and that prevention and supporting those who have that addiction disease. So
Absolutely. In such a small community as well. Like she said, a lot of people she'll see at the grocery store,
yeah.
out in the community, that piece to be able to handle that is incredible. And like you said, it just speaks volumes to her team. So the work they do is incredible.
Yeah. Well, speaking of incredible, we've got Wayne Couture coming up next, right, Gavin?
Yes, Wayne is our director of radiology at Androscoggin Valley Hospital in Berlin. I've had many chances to work with him. He's so knowledgeable. I've constantly said in meetings, we always do some icebreakers in meetings, and we get the question of, what would you do if you weren't in your current role? And Wayne is a big reason I always say radiology. Every
Yeah.
time I meet with him, I feel like I am like, I never knew that. I never knew that. So I'm very excited to have him on.
Yeah, and I'm excited because I've worked with Wayne he came to a health fair or a career fair with me rather, and he's just a good example of the partnership between our local education systems and our healthcare system because he started his interest in radiology when he was in high school and really pursued that through White Mountain Community College, I believe. So it's just a testament to how a community can build a career. So just really excited to have him on.
Absolutely. Looking forward to it.
Awesome. Well, until then, I'm Ren.
And I'm Gavin, and this is Rural Roots, a road less traveled.